Welcome to back pain. Today we're going to cover lots of different back conditions that can cause back pain. We're going to cover what exactly the condition is, what's going on in the body. We're going to cover the symptoms that typically occur with this and what movements typically annoy or irritate this particular condition. We're also going to discuss at the end a very important segment on how to deal with it if you don't exactly know what the issue is, and how to deal with multiple issues, which unfortunately there's more and more of happening. So our focus today is really on application and clarification of all this confusing stuff called low back pain. All right, so we're going to start with just discussing first off that a lot of times these issues might have different ways they manifest themselves. So they might look different for different clients. Some clients might have really severe pain and it's very nervy, meaning shooting and electric feeling. And some people might have the same condition, but it might be more dull ache and not as bad or something. Some people may be able to tolerate some of these things that we're saying are contraindications, if you get them really set up well and have a good core connection. So you want to be careful in how you're dealing with people and really talk to them and have good communication. These contraindications are a good starting point to eliminate them first, and then as you get to know the client's body and they get stronger and better connected in their core, you can maybe start to introduce a very, very small range and see how they tolerate it. Again, very small amount. If there's somebody that's very scared of pain, I wouldn't even do that, but this is something that as they get stronger, they may be able to add back as the injury is not acute and such. So be aware of that. The only condition that this is not the case is osteoporosis. We had a whole nother lecture on that, but I just want to reiterate that one is very unique in that the protocols and the contraindications are set in stone because there is no pain. All right, all the issues that we're going to talk about today, there's pain. Pain is going to be your guide, and it's a beautiful thing because your body is designed with this wonderful feedback mechanism of if this is good for it or if it's not, and it's called pain, so we want to utilize that. If you have clients that come in and are on pain medication or on patches of pain medication delivered through their skin, you want to definitely know this because what can happen, and this happens a lot, people don't tell you that they're on these medications and then they work out and they don't feel anything, so they've turned off that feedback system from their body is designed with, and then the next day they're hurt and they think Pilates is bad. No. This is because you didn't have their natural response system of the pain to tell you what you needed to know. So encourage your clients to wait until after their Pilates lesson to take their pain medication if at all possible, or take a lower dosage of it. If they've got the patches, to put them on after their session and explain to them this is for their own safety, that it's very important that you know if something's hurting them in the moment and you don't keep doing it because you don't want to hurt them. And most people are very receptive to this. It's just one thing that I want to highlight that's very important because the people that have these conditions that we're going to talk about a lot of times are on pain medication for good reason because they're in pain. We just want to use pain as our tool here in the Pilates studio to tell us if we should or shouldn't be doing something as we're working out with them. All right, so we're going to start with the conditions that typically should be avoiding extension, and then we'll get into the avoiding flexion later. So avoiding extension, the first one we're going to talk about is DJD, which stands for Degenerative Joint Disease. All right, sometimes this is also referred to as arthritis, and it's basically a wearing and tearing of the joints and an inflammation to where it's painful. All right, so there's been excessive wear and tear. I would go so far as to say it's probably due to muscle imbalances that have been pulling on the joint for a number of years and over time eroded those joints to where they're now in pain. So what are the symptoms? This varies wildly depending on the client, but usually they talk about stiffness, soreness kind of feeling. They might often have delayed pain, and this can be very tricky to work with. So that would look like if you work them out doing extension, which is one of the contraindications we're going to get to, that the next day they feel pain, but they didn't feel it during the session. They're not on any medication. They didn't feel it, but they don't feel it till the next day. So you really, for that type of person, have to be in good communication with, okay, how did you feel the day after your session last time? And really talking to them, maybe calling them or whatever's appropriate for your studio, and really getting the feedback of if you did too much or too little based on how they feel the next day. So make sure to ask that question for this particular issue. All right, so like I mentioned, we want to particularly avoid anything that's going to be compressive on the spine. So for this client, it's really imperative that you really make sure they get a good, authentic core connection and really stay on them with this, because if they don't, then they are going to get that compression and it's going to irritate things. And you can explain that to them and they'll buy in and be excited about that how you can help them. Also, extension. Extension is what usually irritates the arthritis and DGD in the spine, so we want to really avoid that. As they get stronger, they may be able to tolerate a little bit of this, but again, be aware of that. That's the one thing that usually irritates them. Now, the benefit is that as you're moving this person, for arthritis anywhere in the body, circulation is the thing that helps the most. So getting them moving, even just a little bit every day, is super critical and super, super helpful. I've worked with lots of people with arthritis and they swear that just moving a little bit every day makes a tremendous difference. So giving this person an exercise or two that they can do at home when they're not coming into the studio, unless they come every day, is very, very helpful. Something they can do maybe in their bed before they even get out of bed to just kind of warm up their body and get that circulation going is very, very helpful. All right, the next thing we're going to talk about is spinal stenosis. Now, with spinal stenosis, you have that hole in the vertebrae, which is your vertebral arch, and that's where the spinal cord goes through. And what's happening is that hole is narrowing. That canal is narrowing, and sometimes there's even bone spurs and stuff going in there. The bone is accumulating in that area inappropriately. All right, now the problem with that is that it's hitting the nerve. Okay, so the actual bone doesn't hurt, it's hitting the nerve that's going to cause problems. And again, these symptoms will vary wildly, but a lot of times it's very nervy. So by nervy symptoms, we're talking about electric, sharp, just, really definite sensation, really sharp feeling. And this can be something that is very mild or very debilitating. But you want to be aware that the thing to avoid is the extension. So see the theme? We're all extension so far. So with the stenosis, avoid the extension or do it as tolerated. So again, each person, depending on how much it's narrowed and such, may be able to tolerate a little or none at all, and just be aware that's the area you want to focus on avoiding. So for something like pulling straps, you might do the exercise but just take the extension out of it and just have them hold straight, nice neutral spine. If somebody's got kyphosis with the spinal stenosis, just getting them to neutral will be extending their spine and can be helpful without irritating the spine. So you're working on that posture, but you're not actually annoying them for the most part, for most people. Again, this varies depending on the person, so you really want to have good communication with your client. The next thing we're going to talk about is Facet Syndrome. Now, if you remember from our spinal movement discussion, the facets are actually where the vertebrae articulate and rub against each other. And sometimes these can get kind of stuck and they become dysfunctional and they're not moving right. And this is not good, because then it's going to mess up your movement patterns and cause undue stress on the ones above or below or such. A lot of times this can be avoided with nice articulation of the spine and keeping everything lubricated in that area, but we all know that's not the case with most Americans, so this is becoming more of an issue. They will typically have tenderness and possibly some radiating pain. Again, that radiating pain would be due to it possibly pinching some nerves. So anytime you get that shooting stuff, it's going to be a nerve is being pinched, and they're very quick to tell you that they don't like being pinched. The tenderness would just be maybe some muscle irritation in the area where it's getting hit and the facets are stuck. Typically for facets, the extension again is what bothers them. So watch out for this and be aware that you want to maybe proceed with caution in the extension. Do none at first, maybe add a little bit, and as they get stronger, and see if they can tolerate it, but extension's the one thing you want to watch out for. All right, now we have the spondies. These are just such a great word to say. So first we have spondylolisthesis. Spondylolisthesis is actually a forward slippage of the vertebrae. So this usually happens in the lumbar, low back area, and the vertebrae are slipping forward, so they're not lined up right over each other. Spondylolysis, again, it sounds really similar, and a lot of times we just say spondy, so it gets confusing, but spondylolysis is where the vertebrae are actually fractured. Okay, now this is not osteoporosis. They're fractured from some trauma and stress in the area. Again, usually happens in the lumbar area, but could happen anywhere. And with both of them, the reason that we kind of slang them spondy is because they have similar, almost exactly the same symptoms and the same treatment. So with both of the spondylolysis and spondylolisthesis, they're going to have pain on one side of the body, so unilateral pain and with extension. Okay, so a lot of times they'll be fine walking around until you ask them to extend and they go crazy. So let's guess, what do we want to avoid? You're a smart girl. Obviously we want to avoid the extension and really work at controlling the stability through their trunk, particularly when we're doing core work and getting that really stable and decompressed, so there's not extra pressure on that, and that bone possibly can be released to go back into where it's supposed to go. The other thing that's kind of tricky is loading the front of the spine with the psoas and hip flexion. This sounds awful confusing, but we actually do this a lot in Pilates when we do feet in straps or the feet in the springs on the Cadillac. So anything where you're lying on your back and you've got your feet in some kind of strap mechanism, you want to avoid that. So things like short spine, long spine, magician, just the basic feet and strap series or leg spring series, you want to avoid that for this person. It'll be very shocking of why this is bothering them because you're not doing extension and it seems very confusing. So don't forget this one. This is the contraindication that most people forget, and it's kind of tricky. So for the spondies, avoid the feet, any feet in any straps, as well as the extension. All right, we're going to shift gears, and we're going to go on over to what needs to avoid flexion. So this is the forward bending of the spine. And again, we already mentioned osteoporosis, and that's the one condition that there's no negotiation based on pain because there is no pain. So they don't get to do any flexion. No ifs, ands, or buts. Don't do it. Even if they have osteoporosis, stay away from it. You don't want to be responsible for breaking their back. And that would be highly liable because the protocols are out there all over the place. All right, so the first condition we're going to talk about today is degenerative disc disease, so DDD, not the other one that we talked about. So remember, these two are opposite of each other. So the disc stuff we talked quite a bit about in the spinal movement, and I just want to review and discuss some of the stuff again. So disc problems can range from a thinning of the disc because it's dehydrated and getting kind of crusty, if you will, to actual bulging disc where the nucleus is pushing out on the side, to a complete herniation or rupture where the nucleus, that center jelly part, comes outside of the actual disc itself. And that does not go back in once it's been out. So the problem with the disc stuff is that when you have a problem disc, it's going to start to push on that spinal cord or the nerves that are exiting the spinal canal on either side. So when you're working with disc injuries, you want to avoid the pushing on the spinal cord, because the discs themselves don't have any nerves in them. So it's not pain in the discs, it's the pain of the disc pushing on the spinal cord or the nerves that are going out. So when you flex the spine, that's when the disc would be pushed more towards the spinal cord and cause more pain. So if you've got a disc bulge that's going to the front of the body, it's not going to have any problem. And a lot of people actually have disc problems and don't even know it and have absolutely no pain because it's not pushing into the spinal cord. There's no problem with that because there's no pain. The problem is when it's pushing backwards into the spinal cord. And that's why you want to avoid flexion. The forward bending is going to push the disc back towards the spinal cord and cause all sorts of ouchy pain. This could be from mild back pain to nerve symptoms. Again, it's pushing on the nerves, so it's going to annoy the nerves, and the nerves are going to yell and scream, and they're loud. So avoid flexion and avoid compression particularly. Watch out that they really get a good core connection. And I've seen amazing results with Pilates, with clients really learning how to stabilize this and getting out of pain long term when they start to understand this better and work with it from a core place. All right, now we're going to talk about nerve symptoms in general. Nerve symptoms in general are when anywhere in the body, but particularly in the spine, because there's so many nerves coming out of the spine, are impinged, so pinched. They're being squeezed by a muscle, by a bone, by something structural that is annoying and squeezing on those nerves, and they will scream their heads off, and it's usually, like I mentioned before, an electric or sharp stinging pain, and sometimes it comes and goes depending on if that muscle that's pinching it is tighter or looser. So just be aware that that's can happen anywhere in the body, but particularly in the back, because there's so many nerves exiting the spine all up and down the back. And depending on where they feel it, it may or may not be where it's happening. So for example, a lot of times people feel nerve pain down their arm and shoulder, and the problem is really in their neck where the nerve is exiting the spinal cord, but that nerve runs all the way down their shoulder and arm. So it's not always exactly what you see. So look at the whole body and work for a really good alignment in the entire body, not just where the pain is. Okay, this is a really good example of where pain is not always the indicator of where the problem is. Okay, so we're going to talk about the pelvis. And there's a load of things that go on there, and there's some terms that get kind of overlapped and confused, so I want to go through them. First off is the overarching SI joint dysfunction. SI stands for sacroiliac, so we're talking about where the sacrum, the very tip triangular end of the spine part, is sandwiched in between the two sides of the pelvis. Okay, so there's two joints, one on either side, and together they make like a V shape. Down the tip end is where your tailbone is at the bottom of the V. That gives you kind of an idea. And if the ligaments are not being held, holding this still, or if the muscles, any muscles that attach to the pelvis and or sacrum are pulling on these joints inappropriately, it can cause a wide variety of problems. Okay, so these muscle imbalances are key to SI joint issues. I just want to highlight that because I personally have experienced a lot of this stuff. When people are pregnant, those joints loosen up so the baby can get out, like we talked about in the pregnancy one. And if the muscles are not really well balanced to hold the pelvis still, it can cause a whole bunch of problems in terms of feeling that, because now all of a sudden the ligaments aren't holding that still. And I've had a lot of fun over the years in pregnancies working on balancing it out, and had great success getting things balanced so that I don't have any problems. But over the course of time, I've had some fun experimenting with it. So it's really about the muscle imbalances, what is going to be pulling those bones out of place. So the tricky part is that this could come from like the low back area or that sacroiliac joint area. It all kind of gets gray matter and mushed together, and it can compress the sciatic nerve. Now, the sciatic nerve is the longest and largest nerve in the body, and it branches off into lots of smaller nerves down the back of the leg all the way into the foot. So depending on how much it's being pinched, it can cause a lot of pain, and it's going to be pain on one side. So when we talk about sciatica, this is what we're talking about. We're talking about the sciatic nerve being pinched. And sciatica, a lot of times, is talked about like it's a problem and one of these conditions in and of itself. It's not a condition, but rather a symptom of another condition. So sciatica can be caused by DDD, the degenerative disc disease that we talked about. It can be caused by SI joint dysfunction in general, which we're talking about now. It can be caused by piriformis syndrome, which we're going to get to in a second, spinal stenosis, or spondylolisthesis. So what you're going to notice is that some of these conditions, the contraindication is extension. Some of them, it's flexion. That makes the whole thing really tricky. Which one's going to bother it? It depends on which one is causing it. right, so you want to be really careful dealing with somebody with sciatica that you're working for pelvic stability and muscle balancing in that area, and be aware of what the condition is that's causing it, if possible. They may not know. A lot of times they just know they have sciatica, and working on trying to figure out whether it's flexion or extension or neither that bothers it. So sciatica, again, is defined as unilateral pain shooting down the leg, the back of the leg. So it's going to be that one-sided, it's never going to be both sides, and it's shooting. Okay, really painful. Just people can crumple over, you know, with pain from it. It's very painful. All right, so with SI joint dysfunction, another symptom besides sciatica can also be just general low back pain. They can also have groin pain, particularly at the pubic symphysis, can become very irritated and painful. And, you know, just general pain anywhere in that area can all be because of that muscle imbalances on that pelvis that are pulling the sacrum and or the hip bones, you know, out of good alignment and harmony with each other. So generally for the SI joint dysfunction, you want to avoid flexion and work for balanced muscles. So really do some detective work. What I recommend is to pick one set of muscle groups. So the muscle groups that would be out of balance, we've got the hip muscles, so adductors and abductors, hip flexors, hip extensors, and internal versus external hip rotators. Then you've also got muscles above the pelvis that are going to attach in there. So you've got the muscles that flex the spine versus the muscles that extend the spine. And those are the big ones that you want to check out. Now in my practice, I have noticed that the adductors and abductors of the hips tend to be a really big instigator of this problem. Also, the internal external rotators can have a problem. Any of them could be. It depends on the person. But I usually start with the adductors, abductors. And generally it's the abductors, the outer thighs, that tend to be too tight, and the inner thighs tend to be weak. So you could play with working the inner thighs gently, not aggressively, one time. Don't do anything for the abductors because that would confuse the situation and muddle it all up, and see how they do. So detective work. If you do all different hip motions in one session, it's not going to be clear to you if they have pain afterwards what it was from. So you've got to take it one at a time, and then the rest of the lesson you're going to be working on maybe some arms or some other things that would be separate, so that it's a little different way to structure a Pilates lesson. All right, so that's again trying to do detective work for the SI joint dysfunction. And then I want to talk a little bit about piriformis syndrome. The piriformis is one of the 6 deep external hip rotators, and he gets the brunt of all the blame because he not only crosses the hip joint, but he crosses into the sacrum. So he crosses the SI joint, and a lot of times he gets tight and stagnant and crusty, for lack of a better word, and he can get pinchy on that sciatic nerve. And it's incredibly painful. Again, sciatica is one of the common symptoms with this. But a lot of times people focus on using glute max for all their external rotation. They just do it all from their butt cheeks, and they're not using their deep external hip rotators. So gentle work to kind of loosen up that muscle at piriformis can be very helpful, and then really working on stretching it to open it up. But again, you gotta warm it up with a little bit of work in order to release it. And we went over some of my favorite little tricks to find those deep external hip rotators in the more movement principles exercises lecture and such with that. So this person can have pain in their butt and just kind of general, or they can get the shooting sciatica. Either way, it's not good, and you want to get that opened up. Most people tend to be very tight in their deep external hip rotators, so almost everybody could use a little extra piriformis stretching in there. Okay, now general sprains and strains. A lot of times people will go and help their friend move, and they just kind of strain their back. And I just wanted to delineate some of the terms. Typically, the medical terms strain is talking about an injury to a muscle, versus a sprain is talking about injury to a ligament. Now, this is to say most clients use those interchangeably. A lot of times even the medical professionals professionals use those interchangeably. So if the client comes in and says, I have a sprain, it may not actually be accurate that they have a problem with the ligament. And quite often they don't actually do any, MRIs or anything on it. So just be aware. I don't know, I think typically the public thinks that sprain sounds worse and people want you to take them seriously. So usually when I have clients come in, they say sprain. They don't say strain. Strain sounds kind of like pansy and no big deal. But so be aware of that. They'll usually have a sore pain in the area that they've overused or had trauma. And what you want to do is just leave the area alone. Let it settle down. Let it not be acutely inflamed, but still work them out. So this can get kind of tricky, but you want to get the circulation going, get the blood pumping so that it gets to that area, because that is going to increase the healing capacity exponentially. So we want the circulation. You don't want them to just go on complete bed rest, but you don't want to be annoying and aggravating the area. So if it's a sprain or strain in the back, avoid the flexion extension and all the motion of the spine for a short period of time while it's still annoyed and acute. And maybe do arm work and leg work and such like that. Not, crazy, but get the circulation going. And this is the same in any area of the body. So the circulation is really powerful for healing. It gets the toxins and inflammation out, and it brings the good nutrients and healing properties to the area. So definitely get circulation. This is one of Joe's big things that he was passionate about when he started creating Pilates. He realized that people that were bedridden did not get the healing power. They need to move. And so we want to make sure that we encourage that. Pilates is awesome because it's very easy. I wouldn't say easy. It's much easier in Pilates than in most arenas to avoid an area and just do different exercises. I've worked with people with broken ribs, broken feet with casts on them, broken shoulders and collarbones and all sorts of different things. And if you know the exercises and how to modify it, you can get through that pretty easily and get them to still get a nice workout, which is fun. So leave it alone and just let it rest. Now I want to talk a little bit about complications with all this stuff. So what you'll find is that nowadays more and more people are coming in with multiple things going on, which gets very complicated very fast. And the trickiest thing is when they come in with something like some arthritis in their spine and a disc issue. So that person's not supposed to do flexion or extension. What do you do with this person? And they desperately need Pilates, because what else can they do where they can actually avoid the flexion and extension? So I want to encourage you to know the contraindications and be clear about it, and to be prepared to work with them. And so I'm going to give you an application assignment in a second that's going to help you with that. The other big issue is when you don't know what the issue is. So this could happen in two ways. One, it could be the client just doesn't know. And they come in, they're like, my back hurts. I always kind of have some back pain. This happens a lot. They don't go to the doctor, they don't get any testing done, and that's fine because you can still work with them. And if you want to, what you want to do is start out doing no spine movement. So really get a good core connection with them. Really focus on stabilizing things in their spine and their pelvis and getting them in touch with their body, getting the decompression in their back. And then as they get stronger in that, you could maybe try, again, the detective technique, a little flexion, see how they tolerate it. Maybe the next time try a little extension, see how they tolerate it. And then gradually, if they can do those, make it more and more range of motion as you build their strength up. So again, it depends on the client which one's going to bother them, because you don't know what the issue is. And frankly, you don't need to. If you can do some detective work, just proceed with great caution and have amazing communication with that client. And make sure that they're okay with you doing this detective work. Remember, it's their body. They're the ones that have to walk around with it after you work them out. So make sure that they're understanding what you're doing and they're excited about it, because you're going to help them, figure out what's going on and what they need to avoid. Because frankly, they need to avoid those motions in daily life too. So you can explain to them, okay, so if flexion's bothering you, don't bend over rounding your spine to go tie your shoe. Focus on flexing at your hip and your knee to do it, or have somebody else do it, or you can problem solve some life skills and issues with that, so they don't throw their back out with bizarre little things they didn't see coming. Now, the other situation where you don't know what to do is if you forget the contraindications. Now, of course, you all are going to watch this video 5,000 times and have it all perfectly memorized. But let's be honest, some of these things start to sound the same, and the contraindications might swirl around your head, and if you haven't dealt with it before, sometimes you might forget. So of course, we try not to have that happen, but if it does, the safest place in the moment is to work them in neutral. Okay, so what you would do, what that means, if someone comes in, I've got this and I've got that, work them in neutral that time, really work on a good core connection. That's going to be awesome for them, guaranteed. And then you can go home, look it up, make sure you got the right contraindication, and then plan accordingly for the next session. So this is very important because it happens all the time, and you don't want to look unprofessional. Okay, so the core connection is where it all is going to start anyways, and this is what you want to focus on. All right, so whether it's because the client doesn't know what they have, or you don't remember the contraindications, or if they have multiple issues, one of the great techniques is to be able to work them out without any spine movement. Okay, so I want you to feel comfortable doing this. And you may be thinking, oh my goodness, Katrina, there's nothing that doesn't have any spine movement. But there actually is quite a bit. So spine movement, the ones we're focusing on right now, is really the flexion and extension. But some rotation and side bending could irritate depending on the condition. So again, if we want to be as safe as possible, let's just kill it all. And then you can add it back as you learn more about the client or about their condition, and proceed as needed. Pilates is a great setting to do this. There's actually a lot of exercises that fall in this category. So what I want you to do for your application assignment is to make a list of all the exercises that you know that have no spine movement or front loading of the spine. So the feet and straps and leg spring stuff, again, with those spondies, you want to be careful with, so throw those out too, just in case they have a spondee and you don't know about it. So hopefully, what you can do is you can take that list I gave you of all the balanced body exercises, or if you've already made a list of all the exercises you know, and just delete the ones out that you can't do. And that will make it a lot quicker and easier to make that comprehensive list. This is a really powerful tool. First off, it's going to show you how much there really is that you could do with a person, and most people are very surprised after doing this exercise. Plus, you have that list handy, you're ready to go, and you can just work through that with clients. Maybe you even go take a step further and make a lesson plan for yourself, having that ready from there. So if you have a client that pops in and you don't want to do any spinal movement, you've got a lesson plan ready on hand for them. So go ahead and go make that list, review all these spinal conditions, and get really familiar with them.